Welcome to the Metta Health Talk. Today, we are discussing a topic that strikes fear into the hearts of millions. Yet, it is a topic where science has made the most explosive progress in the last decade. We are talking about breast cancer. Statistically, 1 in 8 women will develop invasive breast cancer in her lifetime. It is the most common cancer in women worldwide. But here is the truth. Breast cancer is not a death sentence. In fact, if caught in stage 0 or stage 1, the 5-year survival rate is nearly 99%. The problem is that most people don't understand the disease. They think every lump is cancer, or that cancer only happens if you have a family history. Today, we are going to dismantle these myths. We will look at the biology of the milk duct, the genetic spelling mistakes like BRCA, and the modern treatments that are saving lives every day. Knowledge is not just power. In this case, knowledge is survival. To understand the cancer, you must understand the organ. The breast is not just a mess of fat. It's a sophisticated factory designed to produce milk. Imagine a tree. The leaves where the milk is made are called lobules. The branches that carry the milk to the nipple are called ducts. Most breast cancers, about 80%, start inside the pipes, the ducts. We call this invasive ductal carcinoma. About 10% start in the factory, the lobules. Now, visualize the cells lining these ducts. In a healthy body, they grow, divide, and die in orderly fashion. But sometimes, a cell refuses to die. It keeps piling up on top of each other, and these cells stay inside the duct, like rust inside a pipe. It's called DCIS, ductal carcinoma in situ, or stage 0. It isn't invaded yet, but if they break through the wall of the pipe and enter the surrounding tissue, it becomes invasive cancer. From there, it can reach right on the lymph nodes, the drainage system, and travel to the bones, lungs, or brain. That is metastasis. Let's talk about the Angelina Jolie gene. Why do some families have so much breast cancer? It comes down to DNA repair. Your DNA is like an instruction manual. Every time a cell divides, it has to copy that manual. Sometimes, typos happen. Normally, you have genes called BRCA1 and BRCA2, breast cancer genes. Think of BRCA as the spell check or the mechanic. Its job is to fix the typos. However, some people are born with a broken BRCA gene. Their mechanic is on strike. So, when genetic damage happens from sunlight, toxins, or bad luck, nobody fixes it. The damage accumulates until it becomes cancer. If you have a BRCA1 mutation, your risk of developing breast cancer rises from 12% average to up to 72%. This is why genetic testing is vital if you have a mother or sister diagnosed before age 50. But remember, only 5 to 10% of breast cancers are genetic. The other 90% are sporadic, caused by lifestyle, aging, and environment. This next session is pro-level oncology. If you get a diagnosis, the doctor won't just say you have cancer. No. They will give you a specific type based on receptors. Imagine the cancer cell as little locks on its surface. These locks are waiting for a specific key to open them and tell the cells to grow. 1. ER+, estrogen receptor positive. This cancer feeds estrogen. About 80% of cancers are ER+. 2. PR+, progesterone receptor positive. This cancer feeds on progesterone. 3. HER2 positive. This cancer has too much of protein called HER2, which makes it grow very aggressively and fast. Why does this matter? Because it dictates the cure. If you are ER+, we give you hormone blockers like tamoxifen to starve the cancer of estrogen. If you are HER2+, we give you targeted therapy like Herceptin that specifically jumps that protein signal. If you are triple negative ER-, PR-, HER2-, it means the cancer has none of these logs. This is the hardest to treat because we can use hormone blockers. We have to rely on chemotherapy to kill the fast-growing cells. What causes the non-genetic cancer? The biggest driver is lifetime estrogen exposure. Think of estrogen as fertilizer for breast cells. The longer your breast tissue is exposed to high estrogen, the higher the risk. Starting your period very early, before age 12, reaching menopause very late, after age 55, never having children, pregnancy gives the breast a break from estrogen cycles. Obesity, this is crucial. After menopause, your ovaries stop making estrogen, but fat cells contain an enzyme called aromatase that turns other hormones into estrogen. Being overweight effectively means your body is manufacturing fertilizer for cancer. Alcohol. Alcohol damages the liver. The liver is responsible for breaking down used estrogen. If the liver is busy fighting alcohol, the estrogen levels in your blood rise. Just one drink a day can increase risk by 7 to 10%. Ladies and gentlemen, please listen closely. A lump is the most common sign, but is not the only sign. Sometimes, cancer grows in sheets or strands, not a ball. Look for 1. Polyarrage, orange peel skin. Does the skin on the breast look thick, pitted and red, like the skin of an orange? This is sign of inflammatory breast cancer, a rare but aggressive type that blocks lymph vessels. It is often mistaken for an infection, mastitis. If antibiotics don't fix it in a week, demand a biopsy. 2. Nipple changes. If your nipple suddenly turns inward invasion when it used to stick out, that implies a tumor behind it pulling it back like a tether. Also look for discharge, specifically bloody or clear fluid without squeezing. 3. Dimpling. Raise your arms in the mirror. That's an area of the skin sink in or dimple. There is a tumor pulling on the connective tissue ligaments. Screening saves lives, but only if the technology fits the anatomy. The gold standard is the mammogram, an X-ray of the breast. It's excellent at finding calcifications. However, we have a major issue: dense breast tissue. On a mammogram, fat looks black. Cancer looks white, but dense fibrous tissue also looks white. Finding a tumor in a dense breast is like finding a snowball in a blizzard. You can miss it entirely. If you have dense breasts, your doctor can tell you this from your first mammogram. A mammogram alone is not enough. You need a breast ultrasound or potentially an MRI. The ultrasound uses sound waves, not radiation, and it sees right through the density. It can distinguish between a fluid-filled cyst, harmless, and a solid mass, suspicious. Don't be afraid to ask your doctor, what is my breast density? If the diagnosis is confirmed, what happens next? In the past, the only option was radical mastectomy, removing the entire breast, the chest muscles, and all lymph nodes. It was disfiguring. Today, we practice breast conserving surgery or lumpectomy. We remove just the tumor and a rim of healthy tissue, followed by radiation to zap any microscopic leftovers. Studies show survival rates are identical to mastectomy for early-stage cancer. We also check the sentinel node, the first lymph node the cancer would drain to. If the node is clean, we don't need to remove the rest, sparing you from lymphedema, permanent arm swelling. And finally, Immunotherapy like Keytruda, this teaches your own immune system to recognize and attack the cancer cells. This is a game changer for triple-negative breast cancer, which previously had few options. We have covered anatomy, genetics, and surgery, but the most important part is what you do before you get sick. While we cannot change your genes, we can change our environment. 1. Move. Exercise lowers circulating estrogen levels. 2. Limit alcohol. Save it for special occasions. 3. Know your body. Check your breasts once a month. Ideally, a few days after your period ends when they are less lumpy. Feel for changes, not just lumps. Breast cancer is a formidable enemy, but we are better equipped than ever to fight it. Don't let fear stop you from getting screened. Early detection turns a crisis into an inconvenience. Thank you for watching this masterclass on Metta Health Talk. Please subscribe and share this video with the women in your life. It might just save you a life.